Hey, welcome to Tuesday's talk. Today's talk is going to be about Brazilian butt lift. Not so much about the procedure, but we're going to talk more about it on a safety issue. There's a recent statement put out about safety with Brazilian butt lift, and there's been a series of deaths related to it. Most of them have been overseas, but not all of them. So the American Society of Plastic Surgeons came out with a position statement on how to be safe with Brazilian butt lift. Okay. First of all, what is a Brazilian butt lift? A Brazilian butt lift is a way to enhance the size or shape of your buttocks, and that's done by doing liposuction to remove fat from an area where you don't want it and inject in an area where you want it. Okay, and that improves the shape, symmetry, fullness, any unevenness you might have in your buttocks. So that's why it's a desirable procedure. Now, why have patients had deaths? The deaths have been related to something called fat embolus, and what that is when the fat gets drawn into a blood vessel and it goes up to your lungs. So usually it gets drawn into a vein, and there's an area on your backside where you tend to have a plexus or a collection of veins. And the statement or the recommendation is, number one, is be knowledgeable of your anatomy, and that's of course why you want to choose a board certified plastic surgeon, because that's some of our areas of expertise. And then you want to keep the fat injected in the subcutaneous tissue, not into the muscle. Now, there are certain groups in Brazil, for example, where they still will inject fat into the muscle, but there's a danger zone towards the inner part of your buttocks that's where the blood vessels tend to be. I personally, for years, have not been injecting into the muscle. The muscle is a great area to inject fat because it has a great blood supply, but whenever there were early on reports about this, I just abandoned that. It was not that critical to my procedure. I can accept using a little less fat and maybe not getting as much enlargement, but not taking the risk of somebody having fat embolus. So, if you're going to have this procedure, considering this procedure, number one, see someone who's board certified by the American Board of Plastic Surgery and who is knowledgeable about the anatomy and about the safety aspects of this procedure. And you may ask them specifically, do you typically inject in muscle? It's a yes or no phenomenon. I don't anymore. I used to years and years ago, but I stopped doing that. It's just not worth the risk to the patient. As always, if you have any ideas, suggestions, or things that you want to hear about, please reply in the comments. Thank you.